Good evening, dear viewers, and welcome to a new episode of Medical Talk, the program that brings you trusted medical knowledge to help you and your family live healthier and better lives.
Digestive health is a key part of overall well-being, yet some serious conditions can develop silently without clear early symptoms.
Gastrointestinal cancers, including colon, stomach, and esophageal cancers, are among the conditions that require awareness and early detection.
Many people may not realize that early screening can significantly reduce risks and improve outcomes.
Understanding the risk factors and recognizing warning signs can make a big life-saving difference.
To help us better understand these conditions, we are pleased to welcome Dr. Hussain Alshamali, Senior Specialist Gastroenterologist. So dear viewers, stay with us. I'm Abdullah Al-Ajmi.
And I'm Dr. Fatma Al-Ansari, and you're watching your weekly program, Medical Talk. Welcome back, dear viewers. Dr. Hussain, thank you so much for being here. It's such a pleasure to have you today with us.
Welcome
Thank you
to
for
Medical
having
Talk,
me.
Dr. Hussain.
Thank you.
So, Dr. Hussain, can you tell us how common is gastrointestinal cancers in Kuwait, especially colon cancer, stomach, and esophageal cancers?
So, based on the Kuwaiti Registry of Cancer, that was published in 2019. It's a registry going from 2010 to 2019. The incidence of colon cancer is around 10% of overall cancers in Kuwait. It's the second most common cancer, secondary to breast cancer. The incidence of esophageal cancer and gastric cancer, stomach cancer, is a bit less. So gastric cancer it accounts for around 2% of of all cancers in Kuwait. Esophageal cancer it's a bit less than that. It's around 1.1%, something like that. So colon cancer is the second most common cancer in Kuwait.
Wow.
Dr. Hussain, what are the main risk factors that increase the chances of developing these cancers?
So there are multiple risk factors depending on the cancer itself. So talking about, say, colon cancer, which is the most common cancer in the GI tract, the risk factors is family history or genetics, as we say. Obesity is a risk factor. Smoking, ethanol or alcohol consumption is a risk factor for colon cancer. These are the main risk factors for colon cancer. For stomach cancer is a bit different. It is a bit similar in regards to obesity, smoking, alcohol consumption, but having H. pylori, which is, as we call it in Kuwait, jarthumat al-maida, is a risk factor to develop gastric cancer or stomach cancer. There's something called pernicious anemia, which is a autoimmune disease when there is a autoimmune disease to the stomach, so the lining of the stomach changes due to an autoimmune condition that increases the risk of gastric cancer. In regards to esophageal cancer, as we said, smoking, obesity, alcohol consumption, but the difference here is GERD, or what we is reflux, or what we call it in Kuwait, al-harij. So having that for a long period of time increases the risk of esophageal cancer. Age for all of them, definitely. Age more than 50 increases the risk of all cancers. Male gender for esophageal cancer increases the risk of esophageal cancer. And for esophageal cancer, interestingly, having very hot beverages for a long period of time as a habit increases slightly the risk of esophageal cancer.
So living a healthy or an unhealthy lifestyle way of living can play a major role.
Yeah, for sure.
In these conditions.
For sure, yeah. So we always advise people to try to live a healthy life. So especially exercising, losing weight, stop smoking, which is a common thing, unfortunately, in our society. And if a patient consumes alcohol, that's a risk factor that we talk about.
Doctor, when it comes to early detection, what screening methods are available for these cancers?
So in Kuwait especially, and even in the Western world, there is no good indication, or there is no good programs to do screening for gastric or esophageal cancer per se. There is screening programs for colon cancer, and here luckily in Kuwait, since I think 2023, the Ministry of Health has started a program of colon cancer screening. The screening modality in Kuwait is based on age, and the modality is which we use is colonoscopy. A colonoscopy, just to explain to the audience, the colonoscopy is basically is a long tube with a camera on the end of it. What we do is when we do a colonoscopy, basically we tell the patient to take a special preparation. It's a laxative, so to clean up the bowel the day before the procedure. And we bring the patient the day of the procedure. We give them some light sedation, and then we insert the colonoscope, which is the tube with the camera, in the rectum, and we maneuver the scope throughout the colon till the end. And then we take the scope out gradually, put some air, and look for any abnormalities or any polyps or any cancers or anything that we need to deal with. The screening age for in Kuwait for any individual, males or females, start at the age of 45. So anyone who is above the age of 45, we recommend screening a colonoscopy to detect polyps or early cancer, or even, God forbid, cancers. For gastric or esophageal cancer, there is no screening modalities, but there are ways of surveillance. So if the patient has any risks of these conditions, we determine them in the clinic. When we see the patient, we would offer the patient an upper endoscopy, gastroscopy. So basically we put the scope, a special scope, same thing, same concept, in their mouth. It goes down to their throat, and we look at the stomach and the esophagus and examine them.
Dr. Hussain, when we're talking about the risk factor, you said it's mostly male are at risk and being above a certain age, if
Yeah.
I'm correct. So you recommend everyone to get a screening or to get a checkup for their colon and their stomach, basically, at a certain age. You said 45, maybe.
Yeah, so for colon cancer, definitely everyone who's above the age of 45 and above, we recommend doing a colonoscopy to screen for colon cancer. For esophageal or gastric cancer, there's no screening programs in Kuwait.
Even if they have no effect.
So if they don't have any risk factors, if they don't have any symptoms, we don't do it. If they have any risk factors, if they have symptoms, then we go ahead and do a screening colonoscopy, or what we call a surveillance colonoscopy, to look for something that we think that they have.
But you still recommend, even if they don't have symptoms, to do this the checkup either way?
For the colonoscopy, yes, definitely, yeah.
Well, thank you, Dr. Hussain, for all that information. Dear viewers, we still have a lot more valuable insights from Dr. Hussain. Stay tuned.
Welcome back, dear viewers, to Medical Talk. We're still with Dr. Hussain Alshamali. Thank you for these valuable information so far, and we'll still continue with this interview.
So, Dr. Hussain, I have a question for you. So, focusing on colon cancer, when should people start screening, and how often should they do it?
So as we said, the screening program in Kuwait, it recommends screening with a colonoscopy starting at the age of 45. So anyone who's male or female, they started their 45 years, we start screening colonoscopy. And how often depends on what we find. So there are many recommendations around the world. In Jabir Hospital here, most of the doctors uses the American or the Canadian guidelines. So what I do, if the colonoscopy is completely normal, we just recommend to repeat the colonoscopy in 10 years' time to make sure that there is no polyps, or they don't develop any polyps. polyps or anything that we can resect. If there is small or a small number or small size polyps, we recommend repeating in 3 years. If there is 5 years. If there is bigger polyps or a higher number of polyps, we recommend repeating in 3 years. It can go down to 1 year or 6 months, depending on what we see and what we remove. So that is usually the recommendation. So basically 45 years of age, do the colonoscopy, and then on the discretion of the endoscopist, he will recommend when to repeat it.
Dr. Hussain, I'm curious, what's the difference between screening and surveillance?
Yeah, that's a nice question. So basically, screening is when you get a population, a normal, healthy population, and you investigate them, or you search for a disease, a certain disease in them. As we said, screening colonoscopy. So you bring a healthy individual who's 45 years of age without any symptoms of colon cancer, and you do a colonoscopy as a screening colonoscopy to look for colon cancer. Similar for a patient who has, say, for breast cancer screening, you bring a normal patient and try to look for something that they don't have. We don't know that they have or not. On the other hand, surveillance is a bit different. As when you bring we have a population of patients with either a high risk to develop a certain condition, or they have symptoms of a certain condition, and you want to do an investigation or a procedure for them to look for the disease. So, for example, if I bring someone who for a colonoscopy and we saw a polyp and remove the polyp, or cancer, for example, God forbids, then afterwards when we do a colonoscopy, we don't call it a screening colonoscopy, we call it a surveillance, because we know that they had something and we're just following them up and monitoring them.
So Dr. Hussain, you mentioned polyps a few times, and they are related a lot to colon cancer. What exactly are they, and are they dangerous?
So that's a very, very important question. So we know that polyps basically are abnormal growths in the gastrointestinal tract, either in the esophagus, the stomach, or even the colon. So we're talking about colon more. So polyps in the colon are abnormal, usually small abnormal growth, and we know from studies from the literature that colon cancer starts as a small polyp, and it grows gradually over time to develop into colon cancer. There are two ways to develop colon cancer mainly. So there is the adenoma carcinoma pathway. So it's a small polyp, grows until it becomes cancer. This accounts for the majority of patients with colon cancer. And there is another way of developing colon cancer, which is a DNA mismatch repair. Basically, the polyp develops into cancer immediately when it grows. That is usually one of the genetic diseases. But polyps per se are small growths that we see. So when we do a colonoscopy for someone who is around 45 years of age or 50 years of age, we see these small growths. So they are benign when we see them. They are benign polyps to a degree,
Yes.
but they can grow, and eventually they reach to the stage of carcinoma, and it's a spectrum. So they grow slowly over. The literature says it can take somewhere around 10 years, 10 to 15 years to go from a simple small polyp, simple growth, to a big cancer.
Okay. So kind of like tumors.
Yeah, go ahead.
Yeah,
They're like.
Yeah, well, we call them benign tumors,
Yes.
but they're not really benign. If we leave them, there is a possibility. No one knows which one will develop into cancer, but they have that potential to grow. They're abnormal. They're not normal healthy tissue. They're abnormal tissue. They are abnormal growth that can develop into something.
And turn malignant.
Yeah.
Dr. Hussain, how are polyps and early detected cancer are diagnosed and treated today?
So when we do a colonoscopy, when we go into the colon and we look at a polyp and we see a polyp. So first of all, we need to diagnose that polyp. So looking at the polyps, we can know to a very good certain degree of certainty what type of polyp is this. Is this a pre-malignant? There are several polyps, I didn't mention that in the beginning. There are polyps that are completely benign and we don't touch, we don't do anything with. They're called hyperplastic polyp. Some people develop them, we don't care about them. We know from the literature they don't do anything. They can't grow into anything malignant. There are polyps that can grow into something bad. So what we do when we look at them, we need to look at them in a way that we know what we are dealing with initially. So we diagnose them during doing the colonoscopy. So thankfully in Jabir Hospital here, we got special scopes that has what we call magnification, which is basically we zoom into the polyp. So what I do here is when I look at the polyp, I magnify, zoom into the polyp. Sometimes I use some special dyes to know what exactly this polyp is. Is this a benign polyp? Is this something high risk, as in developing into cancer or going into that degree of cancer? Or is this really cancer? And even if I see something as in cancer, we can use some special dyes to know, is this a deeply invasive cancer? As in, I cannot remove it and the surgeon needs to deal with it, or this is superficial carcinoma that I usually can't deal with. So when we see the polyps, the majority of polyps we see are small polyps, especially people who come for screening colonoscopies or interval screening. So we see small polyps. What we do with them basically is very simple, very nice. We put a special instrument down the channel of the scope. It's a snare, which is basically a small lasso or a loop. It's a metal loop. We put it on the polyp itself, and we just cut it. We cut the polyp from the colonic wall, and that's it. That's how we do most of the polyps we see, small polyps. Now coming to the polyps that are going into pre-malignant states or high-risk polyps, here we have multiple options how to deal with this. So here, what from one of my experiences here is what I do is if it's pre-malignant or not that malignant and it's big, what we can cut it in pieces and remove the whole thing when it's big. But sometimes when it's big and I think it's malignant or going into malignancy, what I'm trying to do is to use a special knife, and thankfully the Ministry of Health and the head of my department, Dr. Talal Tawil, brought special equipment for me to try to peel that whole polyp or whole mass in one piece and then remove it and send it to the pathologist, and then they will tell me, is this cancer? Is this removed in one piece and that's it? And the patient is cured, or this is even not cancer, this is a high-risk polyp and that's it, we removed it. So these are the ways that we remove polyps.
Well, Dr. Hussain, I think we are thankful for the advancement here in Jabir Hospital and for all doctors. May God keep cancer away from everyone,
Inshallah.
hopefully. Well, dear viewers, we will still have more questions for Dr. Hussain Alshamali after this break.
We're back, dear viewers, and Dr. Hussain, I was wondering, after removing these polyps, especially in early cancers, what does recovery usually look like for these patients?
So recovery is basically very simple. It is usually as a standard colonoscopy. So colonoscopies are a day case procedure. So when we send them, when we finish the procedure, I send them usually back home the same day. We don't admit the patients. On the majority of the patients, we do colonoscopies and the removal of polyps, small or large polyps. We send them home the same day. In the exception of if something bad happens during the procedure, if a complication occurred during the procedure, sometimes we admit them for a day or two, but usually we send them home the same day of the procedure. And the usual question that I get from my patient is, what can I eat? Usually I tell them just whenever you want to eat, you can eat. There is no real restriction. Sometimes the sedation, if it's a deep sedation, usually you give light sedation for patients, and it's fine, they can eat normally. If it's a deep sedation, when the anesthesiologist gives the sedation, they might be more groggy and more nauseous after the procedure. So I tell them just to eat something light rather than having something heavy and like a fatty meal.
Yes.
Dr. Hussain, how important is follow-up treatment to prevent a reoccurrence or a complication?
Oh, so it's very important. So that's when the surveillance comes into action. So we do the screening first, and we remove some polyps. Say, for example, we need to do a surveillance. The question is why we do a surveillance. Why is it important? Because there is a risk that they can develop polyps in the future. So literature says that if we see 1 or 2 small polyps, there is around 3.3% risk of developing further polyps. If we have high risk polyps, as in a big polyp or multiple polyps, the risk can go up to 5%. If it's an early cancer which we remove, the risk can go up to maybe 17% or 18%. So it is very important to repeat colonoscopies according to the doctor's advice, because we know that patient who developed a polyp today and we removed it today, they can develop more polyps down the line.
Well, Dr. Hussain Alshamali, thank you so much for taking of your time to be with us here today.
You're welcome.
And thank you for these valuable information that you provided for our dear viewers. Well, dear viewers, that brings us to the end of the interview, but stay tuned as we still have more segments coming up in Medical Talk after this break.